So we heard all the different aspects from simulation about how to deal with this, the fuel that we need, the legal issues, and sometimes you worry, well, does this all can be put together and make economic sense? Richard, can you help us?
Well, I don't know about that. It seems a rather ambitious question, Helmut, but I'm happy to try. Good morning, everybody. I wasn't planning to start here, actually, but I'd like, if I may, to just make a connection with the panel earlier on this morning and also draw on a couple of things that Gillian said, which I found really interesting. And before getting on to the adaptive licensing question, is really a couple of things about the sustainability of healthcare systems, because it's hard to have a policy conversation about healthcare without the starting point being, goodness, the health systems are unsustainable and health expenditure is out of control, and question marks over what is driving healthcare expenditure. And I was particularly pleased that Gillian acknowledged that in a lot of the models that we have, not just from the OECD, but actually from a number of institutions, in trying to understand where the growth of healthcare systems, healthcare expenditure comes from, often we have a model that ends up saying, well, demographic change isn't going to shift things too much. Really what's explaining most of the growth is technology. And the reality is the technology component is often not a measured component of the model. It's often the residual or the error term. And it's a long time since I've done any regular econometric modeling, but what I do remember is that if most of your model is being explained by the error term, then probably your model is not telling you very much. So I think, what does that say? Does it point to complacency? No, it points to, I think, the absolutely right conclusion, which is that we've got a long way to go before we really have the tools to understand where the growth is coming from, but also to distinguish between good growth and bad growth. There was a very interesting debate in the US recently where, I think in recent years, one has seen a slowing of the growth of expenditure in the US. But very recently, there's been an uptick in the expenditure, and there's been some controversy about why it's ticked up. By the way, the slowing of growth was largely down to large patent expiries of medicines. But why did it tick up recently? And was it a good thing or not? Well, it's been pointed out that most of that recent growth has come from the Affordable Care Act and the expansion of coverage. The point being, yes, there was growth, but you got something out of it. And I think that's really the fundamental principle between good growth and bad growth. Are we getting something out of it or not? And I think I wanted to say that because I think it seems a lot of the initiatives and effort that's been explained this morning is all about trying to say, how can we use better technology to get better data, to understand value more, and be able to distinguish between good growth and bad growth? Because at the end of the day, despite the natural tendency to be nervous about the sustainability of healthcare systems, we haven't actually defined what an unsustainable healthcare system is. There isn't a magic number. There isn't a magic level of GDP per capita beyond which the healthcare system will implode. If you look across the OECD, you'll have some countries spending 4% of GDP, others spending 18% of GDP, and many countries in between. All of them will be frightened about the sustainability of healthcare systems. But actually, I think the question they should all be asking themselves is, how can we be more efficient? How can we distinguish between good growth, bad growth, and make decisions based on value? So I think what I wanted to start is that, I think I work for EFPIA, which is the European Research-Based Pharmaceutical Association. We have 40 corporate members, the largest companies in the industry, and we also represent a number of smaller companies as well. And I think, from that perspective, I think the industry is extremely supportive of this agenda of moving towards value-based systems. And indeed, just from a European point of view, the industry spends around about 30 billion euros every year in terms of R&D. I think there's a very real debate about how is that money spent, and are there ways of spending that money in a way that will help accelerate this transition towards more value-based and outcomes-focused systems? That's a more complicated conversation for another time. When it comes to adaptive licensing, I mean, certainly, and certainly through EFPIA as well, companies are very engaged in this debate. As was mentioned earlier by Hans-Georg from the EMA, when the invitation to the party was sent out, the industry did show up, which is I think, a positive signal that the industry are really trying to, are interested in finding out how this would work and supporting this transition to a world where we collect data throughout the life cycle of the product. I think one of the things as a sort of economist in an organization like EFPIA, who's slightly further away from selling pharmaceutical products than perhaps people working in companies is concerned, is what interests me, and I think the reason why such meetings are extremely important, is that we really need to understand from a long-term perspective where are regulatory and market changes going to nudge the industry. And I think that genuinely we all want the same thing in the long run. We all want the industry to be putting its money into developing medicines that meet genuine unmet medical need, that will be valued. We want that value to be robustly demonstrated by evidence. And we want healthcare systems to be able to have the tools at their disposal to make sensible decisions, both sensible from an economic point of view, rational economic decisions, but ultimately rational clinical decisions, making sure the right medicines are going to the right patients. I think Mark's tools are incredibly useful for part of that picture, and I think it's really very, very important, the work that NewDigs are doing, to give us the tools to be able to test some scenarios. What would scenarios do for investment decisions on R&D? And do those results, are we all comfortable with those results? Do we all think that those results are going to lead to better R&D in better places than we've got today? I think what I wanted to go on, and again, this is a link to the panel this morning, was say just a few things about where the adaptive licensing world strays into the market and the extent to which you could get adaptive pricing and adaptive reimbursement sitting alongside adaptive licensing. And here's where I think we've got a lot more dialogue to go through. I think we've got some countries that are really at the leading edge, doing some very interesting experimentation. And as was mentioned this morning, in one way of looking at it would be that as a company brings a product to market with a rather small indication, and then as we learn about the product over time, we grow the indication, building more data, building more evidence of value. In principle, you could see that the price of a medicine could vary over time. If you get better data, demonstrate more value, you could have a price rise. If you demonstrate less value, your price would fall. So adaptive pricing, with pricing going up as well as down, is a very interesting idea, and I think some of the developments in the UK are very much within that spirit. At the same time, though, I think it's important to be clear that from a global perspective, there is a sort of clash of ideologies if we look at the behavior of pricing reimbursement authorities around the world. On the one hand, you have this kind of adaptive approach based on value. On the other, we see, I guess, a slightly more traditional economic approach whereby the focus is much more on volume. And to be blunt, if you are building more indications, you're selling more medicines to more people, which means I'm buying more from you, which means I want a better deal. So why is this important? It means that you could conceivably, under adaptive licensing, have a situation where in some countries, the logic would take you to a point where price is going up, at a point where in other countries, the logic would take you to a point where price is going down. Now, that's a rather confusing mixed message. And I think, I think another point that Mark made, which I think is incredibly important, is that the sensitivity of investment decisions and how does one interpret conflicting signals from the market way back in time when you're taking a decision about R&D investment is very important, because there are many factors that will change, whether or not you're in the red or in the black. So I think, ultimately the industry, the private sector industry will adapt to what it perceives to be the direction set by the global marketplace. And I think what is really encouraging in the work of the European Commission that was articulated by Olga, Also, NICE are doing some very interesting work and starting some very interesting work, I should say, to try and understand this question about long-term signalling. Where are we taking the industry in the long term? But we do have to be clear that there are different perspectives, certainly within Europe and I guess globally as well. And how these all roll up within global investment decisions is actually extremely complicated. You know, one thing's for sure is that the industry is sort of happy to be part of that conversation, needs to be part of that conversation, but it certainly needs to happen. Final point I would just make, just from a European perspective, is, you know, could you in today's environment have a situation where you have these radically different experiments going on in different countries? So you have an adaptive pricing framework in a country like the UK, where price would go up with more data, and you have, you know, to pick a country at random, the Netherlands, where the price would go down with more indications. Yes, if there was a radically different way of operating in Europe. At the moment, the practices around international reference pricing and trade would mean that difference of approach would be very difficult to handle. So again, what I would say is, I think, you know, we're all trying to achieve the same goal here. There's some genuine unanswered questions with respect to how it would work in the marketplace, and we need to really continue this discussion to work it through. Thanks very much.